to everybody here today as well. I expected large numbers, and we've got large numbers. And what I want you to understand is that we are all actually saying the same thing in terms of a commitment. No. And also to say that I'm somebody who promotes discussion. I'm not afraid of discussion. I think it's very important that we all give each other a chance to have our say. And I can give you the absolute commitment to Scott Parks and to the doctors and the nurses and the allied health professionals, the midwives, those orderlies and others who help the Launeston General Hospital operate and be, as Scott Parks said, if not the best, certainly one of the best of Australia's regional hospitals. And I give you the commitment that I will continue to work with you, because the issues are very complex, and I spent 2 hours yesterday talking to the clinicians, to the nurses, to the management of the Launeston General Hospital, whether or not this government has been committed to help, whether this government has been committed to the Launeston General Hospital, and yes, we are, and yes, we have been. You asked whether or not we have made health the #1 priority, and yes, we have. You can ask me to point to evidence and facts, and I will. When we first came to government, of the entire budget that goes to Tasmania in the state government, we spent 30% of that budget on health and human services, and the rest was divided up to pay for your roads, to pay for your schools, to pay for other activities. Today, we now spend 36% on health and human services.
Just answer the question!
At the beginning of your introduction, you had Kerry Finch talk to you about the fact that we know that if we keep increasing at the rate we are, the entire state budget will go on health and human services, and that just can't happen. What we are doing is what I have consistently said as Health Minister is that our entire hospital and health system is under stress. It is under stress. The LGH is under financial stress. So is the Royal, so is Burnie, so are my primary health areas. We also know that this stress is because we're all getting older, and as we get older, we need more hospital services. That is very true. And it's because of those pressures that the government has invested in the Tasmanian Health Plan to try to help turn around some of what we need to do in our health system. It is part of the reasons of my pressures today. And if you want the facts, this isn't passing any bucks, madam. This is reality. These are pure facts on the public record. To intervene in Mersey, and some of you support that, obviously. What has happened with that is that there is the ability over time for some, we want to be able to, and we will be, reinvesting some of those funds into the LGH. We will also be reinvesting some of those funds into Burnie, because both are responsible for the patients of the Northwest. And we will also have to remember the people of Devonport who also deserve health services. But what I can guarantee to you is every single dollar will be staying in the Tasmanian health system. And every single dollar will be staying in the will be working with the nurse going forward and lobbying Tony Abbott